Okay, so the first thing we're going to do is lumbar supine. Okay, so before the patient gets on the table, a couple of things. You want everything out of their front and back pockets, keys, wallets, cell phones, everything out of their pockets. Have them take their belts off if they're wearing belts, and then have them use the restroom before they get on the table as well. I don't let patients use their phone while they're on the table. I prefer that they just relax and fall asleep if they can. The more relaxed the patient is on the table, the better the treatment it's going to be. So when we're doing a lumbar supine, this would be good for patients that are heavier or older, that can't lay on their stomach. Also, flexion-based conditions would be the best supine. So a spondylolisthesis or a stenosis or anything where flexion makes it better and extension makes it worse. So when we're doing a lumbar supine, what we're looking for is for this red line to be at the bottom of this thoracic cushion right here. Okay, so we're going to line this one up where we want it, and then these two red tabs are equal to the distance from the top of the iliac crest to the lowest rib. Okay, so as the patient gets taller, this is going to slide up. So our shortest patient, these two red tabs will be touching each other just like that. Okay, as the patient gets taller, this thoracic harness is going to slide up. So the pelvic harness always stays no matter what. The thoracic harness is going to slide up as needed. So a 2 to 3 inch gap would be for a patient that's about 5'4" to about 6 foot tall. 4 to 5 inch gap would be about 6 foot to about 6'7". So the shorter patient, this thoracic harness comes down. The taller the patient, the thoracic harness slides up to make more gap here. Okay. So once we know where we want these harnesses, let's say I'm treating somebody who's a normal male height. I'm going to put these harnesses exactly where I want them, and then I'm going to tighten this so that this one is not going to move. And then I'm going to grab here, and I'm going to grab one seatbelt in each hand, and then I'm going to lay this down one time with the red line right at the cushion where we talked about. So I'm going to lay it down one time so I'm not messing with the Velcro, and I'm going to Velcro it right here to kind of hold it in place. Okay. And then what I'm going to do is I'm going to spin around and hold everything with my left hand. With my right hand, I'm going to point to where I want the patient to sit, which is right about here at this angle. Okay. If they sit too low on the table, then when they go to lay back, the top of their iliac crest is only going to be about right here. If I have them sit right here, when they go to lay back, the top of their iliac crest is going to be about where you want it, which is the top of the pelvic harness. Okay, so hold these so they don't move around too much. Have the patient sit about right here, and then have them lay back. Okay, now once they lay back, then what you're going to do is you're going to take this, and with your right hand, I think it's easiest to grab this with your right hand, bring it across and kind of tuck it under, reach across with your left hand, and then bring this straight across so it's nice and snug. Okay, and with my right hand, I just kind of tuck my thumb underneath there so my hand's not in the way. Next, we're going to do the seat belt. And we're going to bring this across. Now, the easiest way to tighten the seat belt, don't grab this and pull. really hard this way, that's going to move the patient if they're in pain. Okay? The easiest way is to grab this with your right hand, grab this one with your left hand, and feed this one through. So you're feeding it through with your right as you're pulling with your left. Okay, so you're feeding that through to get that nice and snug. And then what we want is we want this metal ring to be centered on the patient, okay? Now, when the patient sits down on the harness, this is going to bunch up and there's going to be a lot of extra fabric kind of under their rear end. So what you want to do is you want to grab this and pull it this way, pull it away from the patient to get all the extra fabric out so that's nice and tight, okay? And then you're going to go through this ring and back up and attach to the bottom here, okay? So again, this is all nice and tight now, no extra fabric in there, okay? Then what we can do is put the knee pillows under. Now, if we want the knee pillows to be taller, we can rotate them like this. So if we want more flexion in the spine, then we can use the taller position, okay? So always do all of your lumbar harness first, and then do your upper harness last. So on our upper harness, what we're looking for is to come around and down to make an X pattern. Okay? What you want is for the patient's lowest rib to be right in the middle. The patient's lowest rib is going to be right in the middle here. Okay? So you're coming across and down to encapsulate the patient's lowest rib. Okay? And that should make an X if you did it correctly. Okay? Next, what we want to do is we want to choose the angle that we're going to be treating at. So we go to the computer, and then we're going to go to elevation and targeting, and then we could do a pre-programmed level, so we could hit L5S1 on the computer, and then begin targeting setup, and then we could treat at that predetermined angle. Now, if we don't want to do the predetermined angle, we can always just lumbar flex up or lumbar flex down until we find the angle that's comfortable or that centralizes the symptoms. The most important thing is that you're finding the angle that centralizes the pain, the numbness, the tingling. Anything that makes the pain go farther down the leg into the foot is making it worse. Anything that centralizes and bring those symptoms up towards the spine is probably making it better. So you're looking for that comfortable position that centralizes the symptoms, okay? Now, at this point, if we wanted, we could add some lateral flexion. So if we go to the bottom of the table here, if you squeeze just the left mechanism, then the table is going to laterally flex left and right. Okay, so this would be for a lateral bulging disc. If we squeeze just the right one, then the table is going to rotate left and right. Okay, so when that would come into play is if you have a patient that's sitting in the waiting room and they're leaned like this in order to take the pressure off of the nerve, then you would just recreate whatever lean they have on the table and treat in that position. So if they're in left lateral flexion with left rotation, then you would put the table into left lateral flexion with left rotation, okay? So basically recreate whatever position centralizes their symptoms on the table itself, okay? So whether that's flexion or lateral flexion or rotation or a combination, you want to figure out what positions bring them relief and put the table into that position, okay? or if they're walking down the hallway and they're bent to the left while they're walking, then you would just recreate that position on the table and do the treatment in that position. Okay. So now that we've chosen our angle, now we would want to tighten everything down. So we would come up here, pull this nice and tight, and then we would go up to this upper one up here. So we go up here, pull this one nice and tight, make sure all the slack's out of there. Okay, and then we would be ready to treat. And then so we would go here, go to our automatic decompression menu. If it's their first week, we're going to select legacy number 1. And then we're going to hit confirm lumbar treatment since we're doing a lumbar treatment. And then we would select their treatment kilograms, which is going to be based on 1/3 of the patient's body weight for lumbar or 10% for cervical. So we would put in our kilograms, and then we would select the number of cycles that we want to do. The number of cycles determines the amount of time that the treatment takes. I recommend starting off with 1 cycle for the first visit and seeing how they do, and then going up 1 cycle per visit for the first 5 visits. So visit 1, 1 cycle, visit 2, 2 cycles, visit 3, 3 cycles, visit 4, 4 cycles, and then visit 5, 5 cycles. And then that's about the most you would want to do on Legacy 1, because that's going to be about a 25-minute treatment. That would allow you to do 30-minute appointment times, and your treatment time is going to be about 24 minutes, which gives you 6 minutes to take the patient on and off the table and still maintain 30-minute appointment times. So around 23 minutes is about the most I would do on a lumbar treatment. Your cervical treatments, you can get away with less time. You can do as low as 15 minutes on the cervical and get really good results. Okay. So once we're all set up here, once we've set up our treatment parameters in the computer, then we would just hit start and start the treatment.
Dr. Brian, just tell me one thing. You have just said that we start with Legacy 1 cycle on day 1.
Correct.
In every day we should increase 1 cycle.
Correct.
Okay. So I mean, for how
up
many
to
days
5
we
cycles. Only up to 5 cycles on that.
Up to 5 cycles. Okay. And for next almost 8 days or 9 days, we should continue with those 5 cycles
until you feel like they're stable, and until you feel like you're not going to make them worse, and they're ready to go on to a more aggressive treatment, which would be K1 if it's a herniated or a bulging disc, or K5 if it's a degenerative disc.
Right. So I'm just clarifying one thing. You said once like first 2 weeks every day, 1 session every day. So correct. I'm just asking that if we are just talking about these first 2 weeks, initial 2 weeks, day 1 Legacy 1 cycle 1, day 2 Legacy 1 cycle 2, I mean 2 cycles, then day 3 3 cycles, day 4 4 cycles, day 5 5 cycles. What about till next 14 days? We should maintain with those 5 cycles?
Yes. Unless you feel like you're going to maintain those 5 cycles until you feel like they're ready to progress to K1. Now that might be after 1 week, it might be after 2 weeks, but just do the 5 cycles until you feel like they're ready to go to the next protocol.
So is it not compulsory? Is it not compulsory to continue with 5 cycles for first 14 days or 2 weeks?
Yeah, 1 to 2 weeks is usually about normal for most people.
Right.
Now, every once in a while, you may, if the patient's really stable and they're not that bad, you might progress a little bit faster. Or sometimes patients are just really, really slow to respond, and in that case, then you may want to do the Legacy 1, for a lot longer. It just depends on the patient.
पेशेंट तो कंप्लेंट कर सकता है ना.
Okay, so that's lumbar supine. Now,
Dr.
go
Bhai,
ahead.
one thing. Uh, we just learned that one cycle, one session for first 2 weeks, then three sessions per week for next 2 weeks, and then two sessions per week for next 2 weeks. So in
Yeah.
case if after 5 days or after 1 week, we feel that patient is now ready to progress to next protocol like K1, suppose. So that will be the second week. Can we go for that K1?
Yes, you can go for K1 whenever you feel like the patient is ready. And that's usually
So
just
then
going to
then for how long we should continue with K1?
be generally the whole entire rest of the treatment. So you would do, if it's a herniated or a bulging disc, you would do
Right.
K1 for weeks 2 through 6. Or if it's a degenerative disc, you would do K5 for weeks 2
Rest of
through
the
6.
कंपल्शन नहीं है कि फर्स्ट 2 वीक्स में अगर आपको फील हो रहा हो कि एक हफ्ते के बाद पेशेंट रेडी है के 1 के लिए या के 5 के लिए, तो फिर अगले 5 हफ्ते जो है वो पेशेंट को जैसे, और ये भी पॉसिबल है कि 4 हफ्ते में पेशेंट एक बार फील हो. अरे पेशेंट का कहना एक अलग बात है. वी हैव टू अंडरस्टैंड कि एमआरआई रिपोर्ट आएगी तो उसमें हमारे जो है सीपी की बारी बढ़ा सकते हैं, वो हमारी वो हम वही मैं कह रहा हूँ, तो हमें कंटिन्यू करना चाहिए.
Okay, everyone.
Okay.
Move forward.
So next is going to be prone. Prone is good for your younger patients that have a posterior or a posterior lateral herniated disc. So any patient that comes in between like 20 and 40 years old that's got a posterior bulging disc, and they say that flexion makes it worse and extension makes it better, then you're probably going to put them prone. Now, prone, the reason you would do prone is because on a posterior bulging disc, if they're laying on their stomach, the disc is going to be pointing up. Gravity is working in the direction you want the disc to go. So on a posterior bulging disc, prone is generally going to be a better treatment position. Now for prone, you're probably just going to start out with a table flat. So for prone, you're probably going to start out with a table flat, and then I'll usually go up a couple of degrees per treatment if they can tolerate it. So the first visit, now you won't use, for prone, you don't need these knee pillows. You would just lay them totally flat. And then you may come up into extension about 2 or 3 degrees per treatment. Okay, so as long as they can tolerate it, then with each treatment you can go up into extension as long as they're tolerating it. Now, it might not be super comfortable, but it can be more effective from a treatment standpoint. Okay, and then you can even add a little bit of extension here in the cervical. So this is putting them almost into like a McKenzie type of protocol. And again, this is best for a herniated or a bulging disc in a young patient where flexion makes it worse and extension makes it better. Okay, now they may only be able to tolerate prone completely flat, and that's okay. That's a good position too. So just do prone, but do completely flat. Okay. Now the only difference is with your armrests, you're going to have your armrests in the lower slots facing forward for prone. Okay, so your armrests are down there in the lower slots. Okay, whereas supine, they're going to be in the upper slots in line with the table. So if the patient is supine, If the patient is supine, then this would go in the upper slots, just directly in line with the table there. Okay, so just so that it's flat, that's going to be supine, and then down here is where you put your armrests for your prone treatment. Okay. Any questions? Any questions about prone?
क्या क्वेश्चन क्या है क्या 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 नाम है
तो अगर हम प्रोन में लेके एक्सटेंशन कैसे होगी टेबल नीचे कैसे जाएगी वो ये हम पूछ रहे हैं तो फ्लेक्स डाउन करके आएगा आप फ्लेक्स सपोज फ्लेक्स डाउन ये ऑप्शन
दिस
ये रोटेशन है ना रोटेशन है
लेकिन वो डाउन तो हो जाएगा लेकिन टाइमिंग हम लोग करता है
वो ऑटो करने लगता है वहां से वो ऑटोमेटिक खुद करेगा आप अभी जो लेगेसी आप करोगे उसके हिसाब से वो आप देखो पोजीशन नंबर की पोजीशन को खुद सेट करती है
लेकिन वो सेट तो करती है लेकिन फाइन के लिए करती है ना तो फ्लैग की चली गई है
नहीं प्रोन पे भी करेगी आप प्रोन सेलेक्ट करोगे ना
है वो फाइन फाइन जो है ना ये कभी तो अगर हम लोग फाइन चीज कर रहे हैं ना तो ये हम मॉनिटर चीज हो जाती है फ्लैग सामान लेकिन अगर हम एक्सटेंशन को डाउन लेते हैं तो डाउन नहीं
Dr. Brian,
Yes.
For prone position, when we are going for extension, how we can get it down from the computer, from the monitor?
What do you mean? So there's no predetermined angle for prone. Everything's going to be the same as supine. The only difference is you're just going to manually go up or down depending on how much flexion or extension you want. You're still going to choose Legacy 1 and then confirm lumbar treatment.
wait
एक्सटेंशन करेंगे तो ये टेबल से एक्सटेंड हो जाएगा
ठीक है आगे समझ में अभी भी जब हां ओके कंफ्यूजन इसके लिए
Okay, right. Move forward.
Okay. So next, I want to go over cervical. So for cervical, what you're going to do is you're going to take your pelvic harness, and I usually just drape it off the end of the table out of the way. With your thoracic harness, the one thing you need to remember is you want to take this post out with the thoracic harness, okay? So never pull this through this clamp, because most people will put it back in the wrong way and then it doesn't work. So always when you're doing the cervical, always take this whole bar out with this and then just set it to the side. Okay? Now,
Right.
so what you're going to do is you're going to take your cervical headpiece, and the first thing you're going to do is adjust the width of the head posts. Okay? So a number 2 on each side is about a small female size head. So if we did a number 2, so a number 2 on each side would be like a small female size neck, or a number 3 on each side would be like a larger female size neck and a smaller male neck. Okay, so number 3 on each side. A number 4 on each side would be a large male head. Now, if you get up to number 4, then I recommend taking this pad out as well. Okay, because if you have a really large head, you want it to sit a little bit deeper in there as well. Okay.
Right.
So if you get a really big head and this is pulling out from underneath their head, then take this out so it can sink a little bit deeper.
Dr. Brian, just hold for a minute. We can.
अगर पेशेंट का सर या गर्दन बड़ी है तो आप इसको ध्यान दें तो उसको फोड़ के आते हैं ये फॉर एग्जांपल तो उस कंडीशन में इसको हटा देंगे शायद सर थोड़ा बड़ा हो तो बेहतर होगा कि यहाँ प्रॉपर्ली ये बेसिकली पैट छोटे सर में जरा सी बेसिक सपोर्ट देता है। ये होता है कि जब फोर्थ मतलब इतना बड़ा सर हो तो वो फोर्थ पे आ रहा है दोनों साइड से, तो फिर इस पैर को भी हटा दीजिए ताकि सर और ज्यादा उसमें जो स्लॉट बना है उसके अंदर फिक्स हो।
Okay.
Okay.
Yes.
So next what you'll do is you'll go ahead and place this in between the two face cushions. Okay. So don't put it in the slot where you took the other post out of. It's going to go in between the two face cushions there. Okay. Next, what you want to do is you want to come to the table and adjust the flexion that you want depending on which disc we're treating. So if you go into your elevation and targeting menu, you'll see where it says cervical flexion angle. And then you would go to your chart and you would know that negative 18 degrees is negative 18 is C6, C7. So if we were treating C6, C7, we would take our cervical flexion angle on our computer until it says negative 18 degrees. Now what I like to do is to just take a hand towel and put it over the cervical headpiece, kind of tuck it down under, and then so tuck your towel in there, lay the patient down, and then you're going to bring this up over their forehead, and then bring this just above their eyebrows. Okay, so like that. Now the towel is going to keep all of the makeup and the sweat and everything off of your headpiece. Okay, so that way when the treatment is done, you don't have to wipe everything down every time. You can, everything's covered by this. Okay. And then you can put the knee pillows under for comfort for the knees. And then everything else would be the same, except for your force is going to be about 10% of the patient's body weight. So on the lumbar, we were about a third of the body weight. On cervical, we're going to be about 10% of the body weight. Okay.
Right. Just elaborate a few things. When we are going for this cervical treatment, how we are going to set from monitor? Suppose right now we are at the main menu. So,
Yep, you just go to main menu and then elevation and targeting.
Right.
And then just watch your cervical flexion angle in your bottom left-hand corner.
Right.
And then you would look at your chart that I sent you. And then you would say, okay, C7T1 is negative.
Right.
Yep.
Right. Mr. Bahan is saying that we have not received that chart.
Okay, I'll send it to you right now, no problem. So you would look at the chart and you would say, okay, C7T1 is negative 22 degrees. So you would just go up until your cervical flexion angle says negative 22 degrees. Okay? Or if it was C6, C7, you would go down until it says negative 18 degrees.
ये वो एंगल नहीं होगा, तो वो जिस मतलब करनी होगी उसके लिए जो एंगल चार्ट में होगा वो एंगल वहां आना चाहिए.
Right. Okay, move forward.
So that's it for cervical. And then you would just choose legacy number 1 for the first 1 to 2 weeks. And then you would go to K1 if it's a herniated or bulging disc for weeks 2 through 6. Or K5 if it's a degenerative disc for weeks 2 through 6.
That's right. Now, what about cervical? I mean, what will be the length of treatment, duration of treatment for cervical?
What do you mean?
It will be same 6 weeks for cervical.
Yeah, you're still going to probably do every day for 2 weeks, and then 3 times a week for 2 weeks, and 2 times a week for 2 weeks. Now the
For both
cervical,
for lumbar and cervical both.
yes. Now the cervical will generally respond a little bit faster and easier. So you can get away with, 3 times a week for 6 or 7 weeks if you had to on cervical. Now lumbar, I recommend every day. Cervical, you could do a little bit less and still get really good results. Now, I will tell you, patients don't tolerate the cervical sometimes. They complain that it makes the area go numb back here, or they complain about a temporary headache over the forehead.
Right.
That's okay. That's perfectly normal. I tell patients, just to be patient. The results are going to still be really good, but it's not comfortable for some patients. Now, the other thing I forgot to tell you is if patients are wearing glasses, have them take off their glasses. If they have really big earrings, like big hoop earrings, then have them take off the earrings. But other than that, it's pretty straightforward.
All right. So in case if they are feeling some kind of numbness on the back or headache on the forehead, what should be the way to manage patient? I mean, if somebody is complaining, then how we should do that?
You can add this if you want. So this will go in between the 2 black occipital posts.
Mhm.
So you can add this. I don't like to use this if I don't have to, but you can add that and then add the towel over that to make it a little bit more comfortable as well.
वो एक फर्दर एक्सटेंशन है वो करने के लिए किसी को इसकी वजह से थोड़ा सा फील हो रहा है लेकिन ये सॉफ्ट है तो ये सही नहीं है कोई भी फर्दर एक्सटेंशन है जो कि यहाँ पे यूज हो सकती है और बाकी वो करेंगे ट्रैवल यूज करेंगे तो ट्रैवल भी थोड़ा सा एक सॉफ्टनेस क्रिएट करेगा